So this is my presentation on the physiological responses to common sport injuries. So the first type of common sport injury is sprains, and these are associated with joints and ligaments. So there are three grades of strains that an injury can be labelled as, all meaning different things and having different levels of severity in terms of the injury. So a grade 1 sprain is also called a stretch or an overstretch of the ligaments. So this could be caused by, as I just said, overstretching, or for example, playing football on a field that maybe is uneven or has small kind of holes in the ground, and a player kind of maybe will roll that ankle because they've stepped in the hole. And so a grade 1 sprain, if a grade 1 sprain were to occur, then the athlete would they would actually still be able to perform, however, perhaps not to their full potential. So the joint would remain stable and reasonably strong with an overall good range of motion. There would be some pain and maybe some swelling, but overall it wouldn't be a major problem. The next grade is a grade 2 sprain, which is also called a tear. This type of injury in football, for example, would be caused by a strong collision with another player or possibly by displaying poor technique. If this were to occur, then the joint or ligament would still have moderate stability and moderate to severe swelling. There would be some range of motion, but not enough for the player to continue playing. The final type of sprain is a grade 3, also known as a rupture. This is when the ligament is very unstable and there is no range of motion at all. The joint has no strength and the athlete is in severe pain and there is lots of swelling. When a rupture occurs, it can often mean that the surrounding tissue is also damaged, and this could actually add to injury length and the amount of pain that the athlete is feeling. So this type of injury could be caused by, for example, lifting weights that are too heavy, whilst also using poor technique, such as not lowering the arm all the way down when you're doing bicep curls. So strains are another type of common injury, and these are similar. These have a similar grading system to the sprains that we just looked at. However, there are some minor differences. So a grade 1 strain is also known as a pull, and this is a very common type of injury, especially in sports such as football and rugby. So symptoms of a grade 1 strain include a sharp pain when the injury first occurs. However, it's likely that the athlete would still be able to carry on playing to some level, but unlikely to the same level as they were before the injury. Some signs and symptoms of a pulled muscle include mild pain, some tenderness in the area, so maybe some swelling, but no or minimal loss of strength, stability, and range of motion. A grade 1 strain affects less than 10% of the muscle fibers in that area. So a grade 2 strain is also known as a tear, is similar to the grade 2 sprain that we looked at. So if this type of injury were to occur, it's unlikely that the athlete would be able to carry on performing, as there would be a clear loss of strength and stability, as well as range of motion. And this type of injury affects between 10 and 15% of muscle fibers in the surrounding area. And finally, there are grade 3 sprains, which, like the sprains, are also known as ruptures. And this type of injury causes immediate and severe pain, as well as causing the injured athlete to be able to do pretty much nothing, making them effectively kind of disabled for that period of time while they're injured. So ruptures result in a complete loss of muscle function, as well as the strength, stability, and range of motion that were previously available. And this grade causes between 50 and 100% of muscle fiber damage. So we're now going to look at hematomas, and there are two types. So the first type is an intermuscular hematoma, and this is when the bleeding occurs within the compartment of a muscle. It doesn't escape to the surrounding tissue. So, for example, this could be caused by perhaps a kick in the shin, where you get a little bruise, but it doesn't spread out to surrounding tissues. The other type of hematoma is an intramuscular hematoma, and this is where the blood does actually escape to surrounding tissue, so maybe to different muscle compartments. And this could be caused by maybe a strong collision, so one player's knee coming into contact with the side of a quad, maybe, where you get a kind of a dead leg kind of injury where the bruise is quite big and it may affect the whole kind of surrounding tissue. So now we're moving on to blood clotting mechanisms. And there are four types, and I've kind of drawn a kind of diagram which isn't very clear, but it kind of gives a rough idea of how it would work. So the first kind of stage is platelets, and these are the big circles in the diagram, which, as you can see, cover the main area of a cut. So these kind of act as like a plug to help kind of block out any, just block out and fill up the cut that has occurred. So you then have clotting factors, and these help to reinforce and strengthen the platelets, and these are the kind of smaller circles that you can see in the diagram. You then have fibrin, which is kind of like a web or a glue that helps to stick all these clotting factors and platelets together so that nothing is able to escape. And this is the kind of like yellow lines on the diagram. And then finally you have the other cells, which are actually so small that you can't see them on the diagram, but they fill up any other gaps that clotting factors may have missed, and they also help to add protection. So, for example, white blood cells or red blood cells. So finally, the three stages of healing. The first stage is inflammation. This is the immediate response to an injury, where the kind of sufferer may experience some pain, some swelling, maybe some redness, but this usually lasts between 2 and 5 days. So the next stage is the repair phase, which is where the athlete starts to build up strength and stability and range of motion within the joint or the muscle that's injured. And this usually lasts between 4 to 7 or 8 weeks, depending on the type of injury and the severity of it. And then the final stage is remodel or remodeling, where the joint or the muscle, the injury, is strong enough to start walking on it, maybe to try on it, and maybe even to play on it. But there is still some scar tissue forming.